Welcome to the MCOL podcast, a podcast from the great people and partners at MCOL. I'm Paul Vogelsang, and today's guest on the MCOL podcast is Erin Benson. Erin Benson is Director of Market Planning, LexisNexis Risk Solutions Healthcare. And if you're in the business of healthcare, MCOL is in the business for you. At MCOL, we're proud that since 1995, we've been a leading publisher of healthcare business information, offering online membership, newsletters, webinars, training software, resource books, directories, web content, and now podcasts to healthcare professionals. We help leaders unwrap healthcare business information through a variety of membership solutions. MCOL memberships serve health plans, hospitals, provider groups, physicians, pharmaceutical organizations, employers, government, research organizations, and many other companies. Check out all our great resources, including the MCOL podcast at MCOL.com. Now, let's welcome to today's podcast interview, Erin Benson. Erin Benson, Director, Market Planning, LexisNexis Risk Solutions Healthcare. Good to be speaking with you. Thanks for joining the show today.
Thank you very much. It's great to be here.
Erin, data is now front and center in digital health. Through engagement of patient portals and mobile apps, what are some of the ways consumers are taking control of their health?
That's a great question. It's true. Data is moving at an exponential rate through the digital universe. And so we're seeing more and more ways for patients to play a greater role in managing their own health. So there's really three key trends that I like to highlight that enable patients to take more control. The first trend is that technology advancements have enabled healthcare organizations to bring healthcare to the patients where they are, instead of always expecting the patients to come to the providers or health plans directly. So patient portals, for example, are enabling members to research answers to coverage questions, track claims and account activity, locate doctors and services, pay bills, find health advice online through self-serve options. And then there's all the mobile apps that are allowing patients to fill their prescriptions or schedule appointments, pay bills or access medical test results. They can even track exercise and eating behaviors and more. And then we're seeing telemedicine and health kiosks that, again, technology is bringing healthcare to the patients in locations where they already are. So they're able to receive healthcare at home or at the pharmacy where there's a kiosk. And this ability to more easily access healthcare information and perform these transactions online and remotely has increased patients' control over their own health. The second trend we're seeing is more legislative. So with CMS in particular, we're seeing a lot of encouragement for healthcare organizations to provide the patient with more control and ownership over their own health records. And then the third trend I see enables patients to take more control of their own health by placing an increased emphasis on consumerism. So healthcare organizations are starting to operate more like retail organizations, where they're competing for the business of their members, patients, and employer groups. And in order to do this, they're finding ways to present data insights to patients in ways that are a lot more meaningful to help them improve their own health. So this includes a larger focus on things like social determinants of health, as well as traditional medical care, so that the entire patient is being treated and not just their medical condition. So it's really those three trends that I see enabling consumers to take control of their health more.
Erin, in what ways do major patient engagement activities have data and cybersecurity implications?
Yeah, so technology advancements have been great because they've enabled patients to play a greater role in managing their own health. But these advancements have also created greater challenges for addressing cybersecurity because there's a growing number of access points into healthcare systems. And this has created more opportunities for patient and proprietary data to be intercepted, stolen, and possibly altered. So not only are there now more access points into healthcare systems that provide more ways for fraudsters to try to enter a system, but technologies on the fraud side have also enabled more cyber crimes. So for example, a record 1 billion bot attacks were seen in the first quarter of 2018 alone. Fraudsters are also still using more traditional means, such as trying to log into a member's account online or turning up in person pretending to be that patient. And unfortunately, when fraudsters are successful, it compromises the patient's trust in the healthcare organization, increases costs for the healthcare organization because they have to remediate the breach and potentially pay out false claims. And it also can potentially lead to patient safety risks if any of that patient's data gets altered and then care providers act on bad information. So for this reason, it's incredibly important to balance that need to provide patients with easy access to their data with the need to protect their privacy and security.
We're here on the MCOL podcast speaking with Erin Benson, Director of Market Planning, LexisNexis Risk Solutions. Erin, tell us about what LexisNexis Risk Solutions Healthcare has been doing to help your clients improve patient engagement while also being sensitive to data security needs in the areas of cybersecurity and risk.
Yeah, there's two key areas where we've been helping healthcare organizations to achieve that balance that I mentioned between patient engagement needs and cybersecurity needs. So the first seems a little unorthodox, but basically it starts with, in order to engage a patient, you need to be able to keep their data secure. So healthcare organizations need to be confident in the integrity of the data they're protecting. So this means there should be one golden record for each patient that contains all of their medical or claims history in one place, along with accurate contact information, so care providers are actually able to perform outreach for that patient. We collaborate with healthcare organizations to enable interoperability by first enabling them to automatically and accurately match and cleanse patient records across and within systems. We do this by utilizing highly sophisticated linking technology and vast referential data to assign a unique patient identifier and updated contact information to every record. So using that unique identifier, healthcare organizations can eliminate most duplicate files and prevent mismatches that may jeopardize patient safety and raise healthcare costs. And once they've cleansed their data, it's a lot easier to protect because they've got a clear set of records. Then that's where multi-factor authentication comes in. So we provide physical and digital identity proofing tools to mitigate cybersecurity risks. We conducted a CHIME focus group earlier this year with CIOs and other IT leaders, and they acknowledged that cybersecurity is their top priority. They said there's a need for multi-factor authentication of identities because, as they put it, each layer covers up more security holes. And since we agree that multi-factor authentication is key, we've put together a solution that helps to enable that. So healthcare organizations can utilize low-friction authentication tools up front in the process, like looking at a risk factors within a user's device or checking for behavioral patterns and how they're logging in to determine if risk exists. If everything checks out okay, those users can bypass the other security layers that require their interaction. But if there's any kind of suspicious flags, then those users can step up to other forms of authentication where more friction exists, such as facial recognition checks or verification of key identity elements. The key to our strategy is we want the fraudsters to feel the friction and not make it through the process, but we want the appropriate users to get access to their healthcare system and data as quickly and seamlessly as possible.
What are some examples of identity verification and authentication layers that build confidence for greater member engagement?
Yeah, there are a lot of options out there that can help an identity be verified and authenticated. So we can look at how the identity acts, like looking at behavioral patterns for how the user completes a form on a website, because fraudsters tend to demonstrate a different type of behavior than real members. We can also look at something the identity has. We can validate the authenticity of a government-issued ID like a license or a passport. There are a lot of different options, so we always recommend starting with the low-friction options first because, again, we want patients to make it through as seamlessly as possible. So a good first step in a multi-factor authentication solution is to authenticate the device, like a mobile phone or a tablet, that the person's using to log in. And this helps to prevent bot attacks, malware, or other types of cyber attacks. Other layers of verification could include verifying the email address or the phone number of the account before you send a one-time password. If the transaction being performed is particularly high risk, like payments are involved or particularly sensitive data, or if other forms of verification fail, then you can do knowledge-based authentication quizzes to ensure that the right person is logging in and that they are who they say they are, because only they would be able to answer the types of questions that we ask. So with this multi-factor authentication, IT leaders can act as better stewards of their organizations and their patients' data by covering multiple security vulnerabilities with what we consider multiple layers of defense. This also helps to support the goals of value-based care, which is to enable greater member access to data so that members can engage in and manage their own health. So it really is finding that key balance while making sure to protect the patient's privacy.
Erin Benson, Director, Market Planning, LexisNexis Risk Solutions Healthcare. Thank you so much for joining us today on the MCOL podcast.
Thank you very much.
My thanks again to Erin Benson, Director, Market Planning, LexisNexis Risk Solutions Healthcare, for joining us today on the MCOL podcast. If listeners are interested in learning more about LexisNexis Risk Solutions Healthcare, please visit www.risk.lexisnexis.com. Thanks very much.